any questions. Mother's Day is the 13th, and it's time for Fafos Symphony Under the Stars at the Ocala Golf Club, 3130 East Silver Springs Boulevard. Gates open at 4 p.m. Bring your own food or buy from the vendors. Lots of new things like Kids Art Tent, the Face Painter, the Flower Vendor, fabulous music, and of course, fireworks. Adult advance tickets are $20 and $25 at the door. Children 17 and under are free. Bring mom and the family. The concert begins at 7 p.m. We'll see you there.
All right, 4 minutes after, make it 5 minutes after 9 o'clock, 72 degrees already. Looks like it's going to reach 90 today. So I guess we're back into Florida here. Beautiful day today. That was an amazing story earlier about a boy who was basically given up on, and he had some brain damage. And his mother had already signed the papers that his organs would be donated, and then he came back. He came back alive, and now I guess he's doing okay. Sounds like he's still got some issues, but oh my gosh, sometimes you just don't know. In the world of healthcare, in the world of what doctors have to go through, it's amazing sometimes how sometimes things do a complete about face, whether it's for the better or for the worse. One of probably the scariest diagnoses ever would be you've got a brain tumor, or somebody you love has a brain tumor. Dr. Roger Stupp is on the phone. He is the medical director at the Malnati Brain Tumor Institute at Northwestern Medicine in Chicago, and he's going to educate us a little bit about brain tumors. Good morning, Dr. Stupp. Nice to have you on the show.
Good morning. Thanks for having me.
Where are you right now?
In Chicago.
Oh, okay. And is this something you see on a daily basis, people with brain tumors?
For me, yes. But of course not for an average physician. This is a rare tumor. It only makes about 2% of all cancers. But when it affects you, it has a significant impact both on you and also on the family surrounding. So it is an important disease. Because it is that rare, we see the patients in expert centers, so it becomes for us every day.
Is a brain tumor that is benign treated the same way that a cancerous brain tumor is treated?
No. Of course, in the brain tumor institute, we see also the benign tumors, meningioma. They are frequent. That's the most frequent one. They can be surgically treated, and most of the time they are cured. That's completely different from a malignant brain tumor.
Okay. And is the treatment different today than it might have been just 10 years ago?
Absolutely. If there has been one area of tremendous progress, it's clearly how we manage brain tumors. Some 10 or 20 years ago, it was some surgery, maybe some radiation, and chemotherapy was only the exception. And over the last 10, 15 years, this really has become a multimodality treatment strategy by a team of experts with expert neurosurgeons who will do the best possible job to take out whatever can be seen with modern surgical technology, mapping, awake surgery, followed by modern radiation with new machines, very clear planning, much safer delivery of radiation, combined with chemotherapy, and now most recently also combined afterwards with what we call tumor treating fields. That's electrical fields being added to the patient's scalp, and therefore avoiding that this tumor can regrow and divide.
Wow.
So clearly this has improved survival and quality of life.
Senator Kennedy had something called, is it glioblastoma? Is that correct? Is that the pronunciation? What is that?
Yes. So glioblastoma is the most malignant form of a malignant brain tumor. So when we talk about glioblastoma, we talk about brain cancer. That's a cancer arising in the brain. So that is a cancer that starts in the brain, usually also stays in the brain. It does not metastasize. And it's not only Senator Kennedy, but it's also Senator McCain that has been diagnosed with this disease.
Oh, okay. I didn't realize it was the same thing.
Yeah. And they're both in advanced age. I think Senator Kennedy was 75 years of age. McCain is 80 years old. And it's typical with population that is getting older that we see more of those tumors in the elderly population.
Is there any way to explain why we would get this kind of tumor? I mean, we don't even know why we get cancer. It doesn't seem like, but is there any evidence that maybe it was their diet or their lifestyle or anything like that?
For many cancers, like lung cancer and so on, with relationship to smoking, this is true. For primary brain cancer, no. There's nothing we have done wrong. It surely has something to do with aging, but even that said that, we have brain cancer in children and we have young adults with brain tumors and glioblastoma as well. So it's not only age. It's not the diet. It's not the cell phones. It's not hereditary, so it's not the family that gets it. But they can't tell you why you get it.
One of the things, I as a layperson, I just do a radio show, so maybe I don't even know what I'm talking about, but it seems like we never used to hear about our immune systems being able to fight off cancers, and now we start to hear about that more often. Is that a new discovery, or is that a new development? What is it with our immune system being able to fight off cancer?
So this is actually the fruit of 30 years of systematic research. And it's been some 5, 6, 7 years ago that it was shown that really we can influence with new medication the immune system to help fight cancer, at least certain cancers. So it's been very successful in melanoma. It's very successful in some types of lung cancer. In brain cancer, there is investigation also here in Chicago. But here it takes a little longer still until we find out how to influence the immune system. So it's new for prime time, but it's not completely new for research.
In your work, have you observed something that you think this is going to work? Does one treatment, like, can you look at a tumor and realize this treatment will work better than that other treatment? Just kind of a real broad question there.
So we will actually molecularly analyze and test every tumor of every patient we see in Chicago. And here we have a few percent of patients where we find aberrations, we find molecular changes that will allow to very specifically treat and very successfully. It's the minority, but short of looking, you will never find them. And as we learn more in a systematic way, we have more and more of those patients that we can really predetermine who will get what treatment and what will work best.
If a tumor is deep in the brain, is there a way to do surgery on that tumor without damaging the brain that is between the skull and the tumor?
So here there are new techniques and technology that helps, also guidance, robotic surgery, mapping to really know for the surgeon where he has to go. And if not, then there is what we call stereotactic radiosurgery with LINAC or with gamma knife that will allow to reach a tumor without destroying any other tissue in between.
That is amazing. Just the word gamma knife is fascinating to me. What is a gamma knife?
Gamma knife is a radiation source with cobalt that allows for the brain to very specifically target where we need the beam to be. It's one of many other technologies to actually deliver the radiation in a very high dose in a very precise location.
It sounds like overall the message you're giving to us is good news, but I'm wondering, as a patient, it seems like this information should be information that doctors have. Is that part of what you're doing the radio tour for, is to reach out to doctors so they can get better educated on the treatments?
I think we need to educate both doctors but patients, and I think it's really patients to also educate them to reach out to an expert center when you come down with cancer, and especially with brain cancer. When a disease is rare, you need to have the expertise of a big team where this is every day rather than twice a year.
Okay, I know the listeners are probably wanting me to ask you how to get a hold of you, or at least of the hospital that you're in. Do you have a website, a phone number, anything that they can write down?
So I should be fairly easy to be reached. Easiest is really to go to our website of the Malnati Brain Tumor Institute. It's called braintumorinstitute.org, all in one word. And here you find links to also ask questions and reach out to me. If I can, I will always answer to an email if there is a question, and try to help people to guide them where they can get the expert advice.
Well, thank you, Doctor, for what you're doing. Thank you for taking time to be on the air with us. For the listeners, we did record this. It will be up as a podcast by 2 o'clock today. Please share this with anybody you know and love that might be able to benefit from it. The website that Dr. Stupp gave us is braintumorinstitute.org. Dr. Roger Stupp, thank you so much for being on the air with us today. That is awesome, good stuff.
Thank you very much for having me. Have a good day.
Thank you, Doctor. We'll take a little break. We'll be right back.
On the first and third Wednesday mornings of each month at 9:05, Robert Colin will be with us